Welcome to Adapting Class. Let's practice some questions on end-of-life care. Some few principles you have to follow. And if you follow the principle, you'll be fine. Test-taking strategy, that's all. Which statement from the client need further teaching? Further teaching. Something is wrong. A nurse is providing teaching to a client with what? End-stage colon cancer. It's a terminal patient. Opted for what? Palliative care. Which of those indicates something that the patient said that is wrong? You have to understand palliative care to be able to answer this question. The buzzword is palliative care, further teaching. That's all. These are the two things you should worry about. Don't worry about the rest of the question. And you have to know the key aspect, the principle of palliative care. I will still receive palliative care service if I opted for hospice. Yes. Palliative is our comfort. If you're in hospice, you still receive comfort measures. You go to hospice if you have less than 6 months to live. That is the difference. So this is no problem. Palliative care services priority is for patient comfort. You see what I said? Comfort. Palliative care service will focus on symptoms management. When you're managing symptoms, you're managing comfort. Everything go down to the comfort level of the patient. You're improving the quality of the patient life. That's all. Nothing else, nothing. Palliative care service will focus on caring for what? Curing the disease. No, we are not curing disease. We are not curing disease at all. That is not the basis of palliative care. Therefore, does need intervention, further intervention. That's what it said. The disease cannot be cured. It's determined terminal from the beginning. That's why you underwent palliative care. It's just definition. Okay. Number 2, same topic. Which of the following actions by the nurse indicate end of care, indicate understanding of end of care? The nurse did something, spend time analyzing the last portion of the question. Which actions by the nurse indicate understanding of end of care? That means the nurse should understand end of care. A nurse is caring for a client with what? End-stage colon cancer. That's why it's terminal. Who has 6 months to live? Only 6 months. Patient has history of hypertension, COPD, hyperlipidemia. Which of following actions by the nurse indicate understanding of end of care? Encourage the client to limit sodium to 2 grams per day. Encourage client to avoid fatty food. Encourage client to practice per-sleep breathing. Encourage client to start chemotherapy. Just go back to the basics. Keywords, end of life care. End of life care is comfort measures. Comfort, okay? We are not curing anything anymore. The patient has 6 months to live. You want him to limit his sodium intake. What is he going to help him for? You want him to what? Stop eating fatty food? He's about to die. Let him enjoy himself. You want him to get chemotherapy? He wants to die. He's 6 months. Let him. Chemotherapy is not going to help him. It will expedite his death, rather. Comfort, comfort, comfort. Pulse breathing will help with the COPD and improve his quality of life the next 6 months. That is the way you answer these kind of questions. Don't let them trap you. If you improve, you limit his sodium, it's not going to help him. It's not providing any comfort. So post-sleep is one of the easiest things you can do and improve oxygenation and dyspnea and symptoms that is going to get from the COPD. So once again, you got to look at the question and break it down so that it's easy for you to handle it. If you don't do that, it will be difficult. Which of the following teaching is appropriate? So it's an appropriate teaching regarding hospice. You see, appropriate teaching regarding hospice. A nurse is caring for a client with end-stage brain cancer who has 6 months to live and opted for what? Hospice. Which of this is consistent with hospice? That's all. Or I'm focusing on hospice. Main goal is life-prolonging treatment. No, we're not treating anything to prolong your life. You pass from palliative to hospice, nothing anymore. Comfort and pain management and symptoms. Nutritional support with high calorie to support weight. When patient is in hospice, they are anorexic. It's adaptation to death. They're not going to eat high calorie. You can provide them. They may sip a little bit, but you can't force them. They're not going to eat. This is not going to happen. Aggressive physical therapy. It's too weak to do this kind of aggressive physical therapy. You're not prolonging their life. Quality of life is the goal of hospice. That's all. So that's what you need to provide for this patient. Key aspects in end-of-life care. Which of the following the nurse should include? Which one should he include? A nurse is caring for a client with what? End-stage lung cancer who is expected to die in a few hours. He's about to die a few hours. This is key. The family asks the nurse about signs of imminent death. You see, those are your buzzwords. What are the signs of imminent? Rewrite the question with the buzzword. All I care about, what are the signs of imminent death? When you're about to die, there's near death and imminent. That means you have few hours, seconds to go. You get sleepy. Hormones are released to make you sleepy, make you comfortable, endorphins. Your eyes become glassy and wet. You start crying. Your blood pressure goes down. Your heart rate goes down. Your skin gets cold and mottled. And you have irregular breathing. Therefore, which of the following the nurse should include? Sleepy, glassy eye. You're going to have blood pressure. Your blood pressure is supposed to go down. You will become bradycardic. Your skin become cold. And you have irregular breathing. And that's the imminent signs of imminent death. You should know that. This is telling you the patient's about to die. So when you're observing this, you should let the family know. Same thing, I'm keeping this topic because it's always confusing. A nurse has attended a staff education about palliative care. Follow up, you see, follow up is required if the nurse states what? This is the same thing as intervene or teaching is required. Follow up is required. Pay attention to the words of the question. Follow up is required if the nurse states what? Palliative care helps decrease unnecessary medical intervention. Yes, that's true. It prevents unnecessary medical intervention so that we give you things that we do things for you that will help with your comfort, not to try to do heroic measures that cannot provide you anything. So does not need care, further follow-up. Palliative care ensure lower rate of prolonged grief for the family. The family know what is going to go on. You prepare them so they don't have to grieve. They don't suddenly you die, then they worry about it. They know that you have 2 days, so they prepare. It's the preparation, so they don't have to prolong their grief. So this helps them. Palliative care provides psychological support to the patient and the family member as they about to die. Palliative care is one discipline. No, it's not one discipline. It's multi-discipline or interdisciplinary team involved in the care of the patient. So this one needs further teaching. Number 6. Which of the following medication included in the plan of care will stimulate appetite for a client with what? Severe anorexia. Buzzword, severe anorexia. And we're going to stimulate you. A nurse has attended staff education about anorexia and nausea related to end-of-life care. Which of the following medication, including a plan of care, will stimulate appetite? Which one do you think will do that? That's all. Patient who is dying will not eat. Which of the following will improve its function and let them eat? Aboro does not do that, right? You know, but Dancitron will improve their nausea and they will eat. Dexamethasone is steroid. Steroid and will also stimulate it, help with the nausea, and let the client eat. Manganese stimulate appetite and let them also eat. Dronabinol, this is like cannabis. This will also stimulate appetite and let them eat. So those are the 4 things you can use to stimulate the client to eat and improve their nausea. So 2, 3, 4, and 5 are your best friend. Number 7. Which of the following the nurse should include in the plan of care for a client with what? Severe anorexia. I have severe anorexia. Which one would you include? A nurse has attended staff education about anorexia and nausea related to end of life. Which of the following the nurse should include in the plan of care for a client with severe anorexia? Well, I told you, they don't want to eat. They will sip a little bit. They're uncomfortable. But that is what a dying person do in order to improve their function and then let them go smoothly. You don't want to feed a dying body. That's the thing. The body is dying. They don't need to feed the body. Give them stimulant, appetite stimulant, like the manganese. Clean their mouth when they eat after. Provide oral care so that food can taste better. Let them be involved in food selection. Don't force food on them. If they don't want to eat, fine. But give them small portion of meal if they want to eat. There's no need to place feeding tube. So this should be included in the plan of care. No need to place feeding tube for this patient. Number 8. This one is a little bit hard. Which client will be comfortable with the imminent mortality? There's a lot of words. Imminent mortality, about to die. Who is going to be comfortable? A nurse is caring for what? 4 clients with terminal illness who have 3 months to live. Who will be comfortable with imminent mortality? Rewrite it. I've used a bunch of words in it. Your 4th patient, buzzword, who is really, it will be okay dying right now. He's imminent death. He's comfortable with it. He's satisfied with it. Whatever is coming, he said, death, bring it on. Who is going to do that? Keywords to answer this question: somebody who have lived their life and been able to achieve what they want, number 1. 2, somebody who have endured stress and being able to come out from it successfully without any problem. And somebody who have a good religious, very strong religious belief. These are the people, they're very, very uncomfortable with that. They've gone through a lot of problems. They come out from it. They have endured the stress and they've survived it. 2, they're very religious. And 3, they have accomplished something in life. They said, fine, I'm okay with it. Okay, so who is going to be the problem? 40-year-old who lives alone, who lives with the parent. This guy has not left the house alone. He's still with his parent. He's 40 years old. He can't survive this death. He's like dependent on his parent. 40-year-old who lost his brother, sister, and best friend 3 months ago. He can't do that. He has not even overcome the death of these 3 people. There's no way. This guy has a very strong faith. He's okay with that. This guy got married 1 week ago. He can't leave his wife or husband. He can't survive that death. So this one is the only one who is comfortable with going away. I know we're talking death and dying, but that's end of life care. And next is caring for a client with what? Terminal illness who is experiencing dyspnea. Which of the following the nurse should do first? You have a patient who is having shortness of breath, but then he has terminal illness. He's going to die very soon. Like we said, it's all comfort. Which one is the first thing you would do? Do you intubate this client for comfort? Place face mask on him for comfort? High follow position for comfort? Or call the respiratory therapist for comfort? The best thing you can do, respiratory therapist said, I don't know what to do. Face mask is not comfortable. If face mask is not comfortable, do you intubate him? You put him in the high follow position. So 3 is the best way. Is the best way to improve this kind of comfort. Number 10. The client skin. Now, what is the next best action? A nurse is caring for a client with what? Terminal illness on the hospice ward. The nurse overheard the client's spouse about being hungry, but does not want to leave the hospital bedside. The client's skin is what? Muddled, systolic blood pressure of 80, heart rate of 40, with the glassy eyes. I said this can be a full case you can get. What is the next best action? Rewrite it. Patient is about to die. The wife or husband does not want to leave the bedside. And she's hungry. She wants to eat some food, but she's afraid when she leaves the husband go. When you look at the patient, you the nurse, the client's skin is mottled, hypotensive, bradycardic, and grassy eyes. These represent what? Imminent death. So you have to interpret this as imminent death. If this is imminent death, if the wife leaves, she's going to die. What would you do? Ignore the statement, encourage the spouse to leave, or ask the dining service to bring him some food, or talk to the chaplain. What do you think? You have to be therapeutic. You can't ignore this. If she leave, patient die based on the patient's symptoms, you call the chaplain, he's dead. The chaplain is not going to help you do anything. Ask the hospital dining service to bring the food for the wife so that she can eat and stay there and see the patient die. If you let him go or him, you don't understand what you're saying. Skin that is mottled, bradycardic, hypotensive, and glassy eyes is signs of imminent death. Patients should not leave. So 3 is your right answer. Number 11. Select or apply. Which of the following actions by the nurse need further intervention? A nurse is caring for a client with terminal illness who died in a few minutes ago. No autopsy is required by the family. Which action need further intervention? That means we got to intervene. When they die, leave their dentures so that their face will remain what they were. Close their eyes, okay? Elevate the head of the bed so that their face does not they don't have discoloration from the blood pooling. So this is good. Leave all tubes in line. No, there's no autopsy, so take them out. Insert a rectal tube. If you're going to leave this in and it's wrong, you should not insert a rectal tube. So don't insect the rectal tube. Don't leave all the line. Don't remove the dentures. Close their eyes. Elevate their head out of bed. Remove all the tubes and lines because there's no autopsy. Don't put the rectal tube there. Just put a pad under them and they'll be fine. And the last one. A nurse is caring for a client with end-stage liver disease who is on palliative care. Which of the following actions is most appropriate? These require a lot of content to understand. End-stage liver disease, what is their bigger problem? Is ascites. That's their biggest problem. You want to insert Foley due to low urine output. If they are low urine output, yeah, probably they're close to dying. So you don't need to do anything. Normal saline bolus for low urine output. Somebody with ascites should not get normal saline bolus. They should get albumin. Seroparacentesis for severe ascites. Yes, this action is appropriate for comfort, to provide them comfort. Administer pneumococcal vaccine. Vaccination does not provide comfort. They don't need it. They are about to die. They are on palliative care. This is not going to help them. So give them paracentesis, and that will help with the situation. So this is Adapt NCLEX. If you need more content like that, you join our membership. You get a 7-day challenge. Very good video that will make you pass your NCLEX.